Namaste and welcome to Omega Ayurveda, your trusted guide to holistic healing through the timeless wisdom of Ayurveda. Today, we are going to explore polycystic ovarian syndrome, or PCOS, one of the most common endocrine disorders among women, and a major cause of infertility. Understanding PCOS is a hormonal disorder seen mainly in women of reproductive age, typically between 15 and 40 years. It is characterized by irregular or absent menstrual cycles, scanty menstrual flow or less menstrual blood, pain during menstruation, menstrual duration shorter than 3 days, excessive hair growth on the face and chest, hirsutism, acne, hair loss, skin discoloration, central obesity and weight gain, hormonal imbalance including hyperandrogenism, increased risk of diabetes, endometrial hyperplasia, and cardiovascular diseases. In Ayurveda, PCOS is viewed as an imbalance in the body's natural energies, caused by causative factors, such as improper diet, lack of exercise, excessive stress, and hormonal disturbances. Ayurvedic treatment always begins by identifying and removing these root causes, before initiating corrective therapies. From an Ayurvedic standpoint, the primary causes include excessive intake of heavy, oily, or junk foods, sedentary lifestyle, mental stress and emotional imbalance, hormonal irregularities due to dosha imbalance, especially Kapha and Vata disorders. Once these causative factors are identified, treatment is planned in a systematic multi-stage process. 3-stage Ayurvedic treatment for PCOS. The Ayurvedic management of PCOS can be carried out in 3 distinct stages, spanning approximately 6 months. Stage 1, Day 1 to Day 14. Goal: detoxification, hormonal balance and regularization of cycles. Medicines: Triphala Quat, 30 ml, twice daily. Chandraprabhavati, 2 tablets, twice daily, 6 a.m. and 6 p.m. Manibhadra Churna, 5 gm, twice daily. Duration: 14 days. Stage 2, Day 15 to 4th month. Goal: nourishment, regulation of ovulation, and metabolic correction. Medicines: Shatavari Churna, 5 gm. Shatapushpa Churna, 5 gm. Yashtimadhu, licorice. Churna, 5 gm. Kumari, aloe vera. Juice with water, 20 ml, all taken twice daily until the end of the 4th month. Stage 3, 4th to 6th month. Goal: strengthening the reproductive system and preventing recurrence. Medicines: Atibala Churna, 5 gm. Shatapushpa Churna, 5 gm. Rasayan Kalpa, 4 tablets, 125 mg each, twice daily. Sahacharadi Taila, 20 ml, twice daily. Panchakarma support. In addition to the herbal regimen, Uttara Vasti is a key Panchakarma therapy for PCOS. Procedure: 5 ml of Shatapushpa Taila is administered after the cessation of menstrual flow, typically between the 4th and 10th day of the cycle. This therapy nourishes the reproductive organs, regulates hormones, and improves fertility potential. Lifestyle and diet recommendations follow a Kapha-Vata balancing diet. Light, warm and easy to digest foods. Avoid refined sugar, excess dairy, fried and packaged foods. Engage in regular exercise, yoga and pranayama to improve metabolism and reduce stress. Ensure proper sleep and maintain a balanced daily routine. With the right Ayurvedic approach, PCOS can be managed naturally, restoring balance to the body, mind and hormones. If you found this video useful, don't forget to like, share and subscribe to Omega Ayurveda for more holistic health insights. Stay healthy, stay balanced and remember, nature always heals.